A new study out on the number of weight loss surgeries decreasing as more patients treating obesity seek out prescription medications like Ozempic and Wegovy. So here now to explain the shift is Dr. Nate Wood. He's with the Yale School of Medicine. Thank you so much for being with us this morning.
My pleasure, my pleasure.
Okay, so what are you seeing when it comes to the effect of popular weight loss drugs? Are fewer people getting bariatric surgery?
Yeah, that's what this research is showing, and it's actually, I mean, it's not that surprising, right? In the past, if you wanted to lose a lot of weight, that was kind of the only option. But now, as everyone's seen, these medications are so popular because they're so effective. And for once, we have a medication that people can take instead of surgery. And for that reason, a lot of people are choosing that route.
How much should your age be a factor when you decide which avenue to go?
Yeah, that's a really interesting question. So, if I think about my young patients, perhaps they don't want to take a medication the rest of their life. And if they're young and otherwise healthy, they're going to tolerate this surgery really well. The downtime won't be so bad. Maybe that's the right option for them. But then for older folks who maybe have a few more, illnesses and comorbidities, the downtime would be a lot. Maybe a medication is a better option for them. So as an obesity medicine physician, it's my job to kind of lay out all the options and go through it with my patients. And ultimately, it's a patient-by-patient decision. But
and that's so important. And what you were just saying about, so I'm just fascinated by it because people are still getting surgeries. They may be getting less of them. You say it depends on a number of factors because you could also do both.
Yeah, that's right. It kind of depends on how much weight is your goal to lose. And each patient has a different goal, and doctors have different ideas of what might be safe or desirable. So if you want to lose maybe 5% of your body weight, lifestyle interventions are probably going to be enough. If you want to lose 5, 10, 15, medications are great options. If you want to lose 20, 25 or more % of your body weight, bariatric surgery is still going to be a great option.
So, sorry, go
ahead.
Then,
yeah, for folks who have bariatric surgery, lose the weight and then start to regain it, then we can actually add on a medication afterwards. And in that way, you can get both.
And so how do you start this conversation with your doctor? I imagine it's slightly uncomfortable for a lot of people. They might be self-conscious about it, have a lot of questions. What do you recommend?
Yeah, I find that a lot of patients don't ask their doctors about it for that exact reason, but a lot of doctors don't ask their patients about it for that exact reason. So I don't bring it up at the first visit. I don't want my patients to think that their weight is all that I care about because it's not. But what I recommend is that if patients are interested in talking about it, bring it up. You can blame it on the media. Say something like, oh, I've seen these meds everywhere, and I'm wondering if one might be right for me. And it's as simple as that.
And an important reminder, because what you did say before, when you start taking it, you do have to continue taking it.
Yeah, the weight,
that's the thing.
The weight gain comes back if you stop, yeah.
Okay. Thank you so much for being with us, Doctor.
pleasure.
Would appreciate it.